Okay, good to go.
Good morning, everyone, and welcome to this meeting of the Isles of Scilly Local Outbreak Engagement Board. This meeting is convened under the provisions of the Local Authorities and Police and Crime Panels Coronavirus Flexibility of Local Authority and Police and Crime Panel Meetings, England and Wales, Regulations 2020. If I could introduce myself, I'm Councillor Fran Grottick, and I have apologies from Councillor Robert Francis, so I'm chairing this meeting in his absence. May I firstly ask for any declarations of interest, please? No? Fine. Then I shall now ask the Administration Officer if he would please conduct a roll call.
Certainly, Chairman. If we take it in the order on the agenda, Councillor Harry Legg.
Yes, present.
Councillor Joe Williams.
Yes, present.
Tim Clark.
Yeah, good morning, present.
Mrs. Langdon.
Good morning, present.
John May.
Morning, present.
Sergeant White. No. Dr. Wigglesworth. But obviously Dr. Curry is in her absence. Is that present?
Present.
Thank you. And Paul Charnock. There's nobody else on the agenda, Chairman. Is anybody else present? Could they please identify themselves?
Remind me of Stephen, Paul, Masters.
Thank you.
Thank you very much. Thank you, Mr. Taylor. Could I now move to a consideration of the minutes of the meeting, of the previous meeting, the 22nd of September? Has anyone anything they would like to raise with regard to those minutes, please?
Fran, it's Chairman, Vice Chairman, it's Paul here. Just there's a bit of tidying up in some of the officers' titles, and it looks as if Tom's Deputy Monitoring Officer, but that's just a typing type thing. We'll sort that out. Nothing fundamentally wrong with the minutes.
Thank you. Could I have a proposer to approve those minutes, please?
Yeah, happy to propose.
Thank you, Councillor Williams. Is there a seconder, please?
Yeah, Councillor Legg.
Thank you. Has anyone any objection to the approval of those minutes? Then we will take those minutes as approved. Thank you. We'll now move on to Part 1 reports. They will all be verbal reports which the board are invited to approve. We'll start with an update on the local outbreak and evacuation plan, a monthly update with Dr. Whitney Curry to present, please.
Would you like, Chairman? Sorry, Whitney. Would it be all right if I gave an overview before Dr. Curry comes in, Chairman?
Of course. Thank you, Mr. Masters.
I think just to give members some context, I mean, you'll recall when we originally started talking about the engagement board that we had stood down the emergency management response at the end of June and stood up the sort of outbreak planning arrangements. It's just so you're aware that as things have begun to escalate over the country, some of those emergency management processes are beginning to be stood back up again. So you would have heard that there's a strategic group under the Local Resilience Forum that now has been asked to be stood up and is meeting every Monday afternoon. And we are making a weekly return now to MHCLG via the LRF in terms of our plans and preparedness. So we're sort of, some of the processes that we had stood down at the end of June, we are beginning to stand back up again now as we move into the winter. You'll have seen also that we did issue some advice for people travelling at half term on the website, and we have updated the contain framework. And it might be worth Tanya later on just giving you a bit of an update on the contain framework to remind you what it is. And perhaps we might circulate that to members so that you have that ready to hand if people have any particular questions. Globally speaking, and Whitney will no doubt go into the detail, Overall, in terms of the southwest cases, in positive cases in Devon seem to be slightly diminishing at the moment. Cornwall cases are reasonably static, and we're hovering around just under the 30 cases per 100,000, which puts us in the third lowest area, unitary area in the country at the moment. We have also been issued some further guidance in terms of some of the sort of points in the year that come up at the moment, where people begin to congregate. Obviously, Halloween, in terms of trick-or-treating, we're trying to discourage that. Bonfire night celebrations, particularly large organised events, obviously won't be supported or encouraged. And also, there's been a very much trimmed-down approach to Remembrance Sunday. We're absolutely making sure that we're going ahead with a celebration and remembrance on Remembrance Day, but it would be a very, very small event just for dignitaries and a 15-minute service. So we'll be encouraging people moments of self-reflection by watching the national celebrations or remembering in their own homes. So there's quite a lot beginning to happen again in terms of COVID from a sort of council point of view, working alongside colleagues in public health. That was just a context from me, Chairman.
Thank you very much, Paul. Any questions for Paul, please? Tanya, would you like to give us a few words on the containment area now, or would you prefer to wait until later?
No, I can do that now. That's fine. So the contained framework was approved by full council previously, and since it's been approved, we've made some additional changes to it, not significant changes, but just minor tweaks, particularly around decision-making process and Paul's role within that. So that's now a working document. It won't be going back to full council for approval again. However, it is held by the council, and we can distribute it to the members if you require it. Would you like a quick update on testing?
Yes, please.
So testing is continuing to work well. We're still turning around tests sometimes in less than 24 hours, which is really good progress. However, I think I just want to stress the importance of going into the winter season, and obviously with the Salonian stopping running at the end of the month, we will be reliant on just the flights to transport the swabs for testing over to Treliske. So we are putting in place a slight change in process, which means that we'll be prioritising the tests for key workers and families of key workers to make sure that we can get those off the island as quickly as possible. We're also going to be changing the timelines around testing so that we're going to be meeting that 10 a.m. freight flight that goes every day. So if anybody does require a test, we'll probably likely to receive the test the night before from us, and we'll be picking it up first thing in the morning in order to meet that early morning freight flight. So it's just reassurance, really. The testing continues to work well. We are undertaking all the elements of testing that we can do to the best of our ability. We're also still pursuing on-island rapid testing. So as soon as there is rapid testing available, we'll be implementing that. But that's obviously working with our really close colleagues across the peninsula, the testing peninsula, the southwest, and colleagues at Treliske. But I'll keep you updated on that, and hopefully I'll have some good news next month.
Thank you very much. That's very useful. Has anyone any questions they would like to ask Tanya?
Yes, I have one. Steve Sims. I was asked this by a member of the public and another councillor, and I started asked. Specific was regarding Mundersley. Now, I understand there's a system in place if somebody develops symptoms in Mundersley, but I was asked specifically what happens if the child develops the symptoms on the weekend, i.e. they could come back and so the issue was possibly there wouldn't be any result of this until, say, the Tuesday. So that was, I assured them that I was sure it's in hand, but I thought I said I'd ask anyway.
Yeah, absolutely. So Public Health have been working very closely with the school in the recent weeks to develop new procedures and plans should that happen. And the school communicated something. I think they provided an update yesterday. So they're putting plans in place for safely transporting the children back to their homes at the weekend, and that process is going to be risk assessed and approved by Public Health prior to anything. Prior to that happening. So similar to the evacuation process, but obviously on a smaller scale. And all the plans that have been approved or that are being put in place have been done so in consultation with Public Health. I don't know if Whitney wants to add anything further to that.
I don't think I'd add anything further other than it's always risk assessed on a case-by-case basis. So again, much like the evacuation procedures that we have in place, it's not a blanket situation. It is, we'll see what's going on and make sure that we're doing it as safely as we can, both for children, staff, and the wider public. So, just making sure that we're all aware that we wouldn't just be doing the same thing regardless, okay?
Yeah, I think that's broadly what my response to them was anyway. That's great. Thank you.
Thank you very much. Dr. Curry, would you like now to continue with the local outbreak and evacuation plan update?
Sure. Everyone's taken all my updates.
I do apologise. Councillor Williams had a question.
I beg your pardon, Joe.
No, it wasn't necessarily a question. It was, again, just to emphasise what Tanya said. The school, the academy have been very proactive, I'd have said, in the last 3 or 4 days with 2 or 3 updates which have made specific reference to Mundersley. So if Councillor Sims is approached by any parents, I'd suggest they perhaps check their emails or get signed up to the school's information system. The various protocols have been made quite clear through that route, I would have said.
Thank you. I think it's very reassuring the way our special circumstances seem to be in the forefront of everybody's mind, and the schools seem to be being very proactive in managing the situation together with Public Health and everyone else. Thank you. Right, Dr. Curry, unless anyone has any other question, the floor is yours.
Thank you. I just have a couple of additions to make to what colleagues have said in terms of local outbreaks and evacuation planning. So as Tanya has said, we are continuing to test regularly. I think residents on Isles of Scilly have a good understanding of how to get tested, when to get tested, and what to do at that point. But the alert, the incident response team is still supporting people. So if they're self-isolating at home, if their households are isolating, they're still getting calls, they're still getting support from the alert as a whole. And feedback from that process has been really good. Your residents are really appreciating that contact and that support. Even if they didn't need anything at the time, that contact with someone else who understands what's going on has been really, really helpful. In terms of, is it okay if I just jump into the numbers? Because I think the numbers is something everyone is always quite concerned about. And so you will have known in recent weeks that we're pointing residents of the Isles of Scilly to the main government website, which is going to let everyone know about how many cases there are on Isles of Scilly, because it's very unlikely, unless there are very specific circumstances where we need the public to do some kind of an action to help us with the outbreak. We're not going to regularly tell everyone how many cases are going on, what's active, what's not active, that kind of thing, but rather work in the way that other local authorities in other areas work in terms of having the public access that information online. And so you will have seen when some cases popped up last week and the week before. You will have seen this week where it said there was suppressed data. It does explain on the website what suppressed data means. So that means there were fewer than 3 cases over the past 7 days. So that's, again, comes down to how we try to protect the confidentiality and anonymity of positive cases. This is going to happen really regularly, and it's an uncomfortable position to be in, but it is the position that we are all in. So we're all in the same thing. No matter where you live in the country, this is how everyone is sort of finding out how many cases are going. It just happens for us that it's come much, much, much later than it had for everyone else, because we hadn't had cases for so long. So that you're aware, anyone getting tested, it actually doesn't matter how you're getting tested. on Isles of Scilly, even if you try to order a home test, which I'm pretty sure you still can't get, even if you're tested through the hospital, through anyone else on Isles of Scilly, the local incident response team will always get those results. We have that data sharing agreement through public health. So we'll always know if residents on the Isles of Scilly currently are being tested and what those results are, positive or negative. If your residents are away from the Isles of Scilly and actually even away from Cornwall, getting tested and isolating elsewhere, we won't know until there is a positive result. And it takes a bit of time for that positive result to come down through us. We're working with Public Health England at the moment to speed up that process, because obviously what we want to do is find out, ring those people as an incident response team and offer them support in isolating, and also make sure they're not trying to travel back on public transport. And that's one of the key things there. So we're working with Public Health England to make that time in between being notified and positive cases becoming known much quicker. But you will see these if you've got residents away from the Isles of Scilly getting tested and isolating elsewhere. Those will also hit the website, and we are going to increasingly see that. So I just want to make sure everybody kind of understands how that works. We've got our local enhanced testing service, and we know how that is. But elsewhere, we don't have control over when people get tested, how they get tested, and how quickly those results come through. But we do get those results. For example, you will have seen the suppressed information over the past few days. We did get those results. We know who they are. They're being supported. It's well taken care of. It's very, very unlikely, as I say, that we'll issue any sort of separate announcement on those cases. There are just so few, and unless there's something specific that we need you to do, I was speaking with a colleague earlier, and he said, so what is that threshold? When are you going to ask us to do something? What warrants that sort of action? And I think that's a really good question. Every sort of case is risk assessed on a case-by-case basis, not just with me, not just public health, not just with Alert, but we engage with Public Health England, we engage with our hospital colleagues, our healthcare colleagues, to understand what's going on and determine whether there's any wider action needed. Part of that is looking at that contained framework that Tanya is talking about, that there are settings, location, or groups of people that we need to start intervening with to be able to prevent any further spread of COVID-19. But at this moment in time, we've not had any situations that warrant any sort of a larger action or communications in terms of response. So we've been, actually, your residents are just so good at following the prevention rules, following those isolation guidelines and policies, and we haven't had any larger outbreaks or situations at this point. Doesn't mean it can't happen. It can happen to anyone, but we're well prepared to be able to deal with those. But I just wanted to make that distinction over testing on the islands and testing that happens elsewhere in terms of kind of informing the public. Keep going to that website, but it's not the case that we're going to be able to unpick it and explain every case that comes along publicly. But behind the scenes, we've got that information, and it's well in hand. I know that feels like an uncomfortable position to be in. Everybody wants to know, but it is genuinely for the purposes of protecting those people and for the outbreak response as well. Should I pause there for questions? And then I've got a couple other bits and bobs for updates, because I know that was a lot.
Yes, that would be good. Thank you. Questions for Dr. Curry, please?
Yes, Dr. Curry. Sorry, I was just trying to take all that in and form a question. You mentioned that there are people who aren't necessarily on Scilly, but the numbers show up for Scilly because they're connected with an Isles of Scilly address. Yeah. Is that not misleading? Should the numbers not show where that person is and where the case was transmitted to them?
That is a really good question, and it's one that, trust me, you're not the only ones dealing with this. That I've hit up lots of my colleagues in other areas that have similar population flows that you do. So your population has seasonal workers that come and go. You've got a population who actually have many homes, more than one home across the country. And obviously you've got university students, children who go across back and forth. You've got lots of different flows to your population. And so it's about looking at each of those. So it's very possible that some of those, before I say that, it's very much dependent on what address people give when they get the test. If they're on the islands, we already know. Sorry, you can't get away from us. Local engaged, incident response team already knows. But in terms of people who are away, if they have more than one address, it depends on what address they give as to where it will hit. Now, that's not to say that later on, when we get the notification and we start to unpick that we can't designate that to another area. But, people who are away just on holiday or staying with family or friends, if their main residence is Isles of Scilly, it is still going to hit us. If their GP is registered as Isle of Scilly, it will still hit us. And this happens all the time, actually, on the mainland. People haven't ever changed who the GP is that they're registered with, for example. So there are those nuances to unpick. Some of them we can unpick, but unfortunately, some of them, even though it feels like they definitely shouldn't be attributed to us, we might still get them. And it's very difficult to kind of get rid of those, as it were.
Can I, Chairman, if it's all right, add to that for Harry? I was on a national ministerial webinar last week, Harry, where Lord Bethell was on the call. Lord Bethell is the head of track and trace nationally, leading from the government. And this was a question that came up from numerous parts of the country where, people were particularly concerned in small rural areas where they were showing positives they didn't know about. And it was the same issue as Whitney's just talked about. It was, the wrong details either on apps or on the testing forms that people are filling in, and then it automatically shows up on the map. They said they were going to try and stop that happening, but obviously recognised the fact that it would be impossible if people put the wrong address down. So as Whitney says, we're doing everything we can. Nationally, they've identified it as an issue, but it wasn't, as I think was reported on Facebook, that we were suppressing or hiding the information. The information was from that national website, and it was because somebody put the wrong address down.
It's an ongoing issue, and that's why I'm saying it's going to feel uncomfortable. This data that comes forward as we move on, it's going to feel uncomfortable. But that we do have the correct data flows. There's a bit of a timing issue with some of the wider PHE data that we're working on. But at no point do we not know what these cases. We might just find out a little bit after they've been tested if it's somewhere on the mainland, and we're working on closing that information gap. But what I'm mostly concerned with is that your residents feel really confident and really well informed by that data. So if you're seeing things that don't quite make sense, have a look through. So the language, and Polly just made me think of it when you said suppressed, that language that they use on that government website is hideous. Suppressed data, it sounds horrible, but it genuinely just means there's not enough people for them to warrant giving out the numbers to protect people's confidentiality. And that stuff is on that website. So it's just a matter of, it's a horrible website, I won't lie, I really don't like it. But going through that website and reading through it and making sure that you're understanding what they're telling you, because it's not super easy to do that. But I want the public to feel confident and feel informed, and that is one of the best ways to do that, is to shoot you straight to that government website, because it takes us out of having to balance that issue between giving too much or not enough detail, because it is genuinely our job to protect those positive cases, protect their confidentiality, and make sure that they're safe and healthy, rather than giving out wider details that could actually put that in jeopardy. So I just wanted to make that quick point. Were there any other questions? Sorry, Chair, before I moved on.
Yes, I'd just also like to ask about, obviously you mentioned sort of everything would be done on a case-by-case basis, but now that we have a national tier system, are we part of Cornwall in terms of the tiers, or are we separate? And at what stage would we be considered to move between tiers? Because obviously with such small numbers, it just doesn't make sense to look at it in that sense.
No, you're right. And Paul and I have been on this case quite a bit, both with the national team and the regional team at the moment. I can't give you a specific answer on it now. I think it would be disingenuous to do it, or even to sort of give my assessment of it, because we're waiting for Public Health England to come back to us. So even if we were, even if they decided to assess us as separate local authorities, there has to be that acknowledgement that even though we might be separate, there's so much overlap in terms of our population movement and resources and all of that, that even if one went to a higher tier than the other, it's going to affect each other. So we've got to work together in that respect. So leave it with us. I will provide an update. That's what we're working on, Paul and I, and then we'll come back to you on it. But at the moment, we're not seeing numbers that would warrant us jumping into another tier, even just in Cornwall, let alone Isles of Scilly. But we're conscious that it doesn't take a whole lot to be able to tip you over into that, so we want to make sure we get clarity as quickly as we can.
Absolutely. And again, Chairman, if it's all right with you for Harry, I raised this nationally with Robert Jenrick last week, Harry, and used the cities as an example in terms of, it only takes a very small number to push us into, the stats which show that you need a sort of level 3 lockdown, which would be ridiculous. So my starting position is that it would seem more sensible that for this purpose only, it's not about us being part of Cornwall, but for this purpose only, I think it would be sensible for us to be seen as Cornwall and the Isles of Scilly, if not Devon, Cornwall and the Isles of Scilly as the LOF area. But I've done a written question to the Secretary of State on that particular point, and they're usually quite good at coming back within the week or so. So as soon as we get the answer, Harry, then I'll circulate that to the board.
Thank you, Paul. And then one final question. You mentioned with low numbers, you don't need to necessarily communicate that to the public. But at what state would this board come into effect? We are obviously set up to discuss outbreaks. So when would you bring something to the board to discuss about whether or not communication should go forward to the public?
Yeah, it's really difficult to give hard and fast sort of ideas on.
I appreciate that.
Yeah, but if we started to see something that was more than a handful of cases, we're working with Public Health England regardless of the number anyway, and we'll always touch base with them and say, what do we need to do here in terms of the wider community, or even in terms of, population, settings, pubs, restaurants, that kind of thing. So it's always a question in our head, and also specifically around transport. So in our discussion, so think of it as an incident management team kind of situation. So you'd have public health, members of the LERT, Public Health England, for example, having that conversation around any kind of an increase in cases or an outbreak, and determining where that support needs to go. If we determine that it's more than just supporting a few people to stay at home, then we would likely be coming to you as the local outbreak engagement board saying, we really need your help in communicating to the wider community about XYZ, for example. I know that feels a bit wishy-washy, but it is genuinely kind of the case that there is no hard and fast, but that when we get to that threshold, based on that risk assessment, we would come to you.
Okay, thank you very much. I'll let anyone else ask any questions they might have.
Dale's got his hand up, Chair.
Yeah, thank you, Paul. It's Dale from the Harbour. Dr. Corey, is the NHS app used for the data that you're gathering? Is it used, the venue check-ins which people do for visitors or anybody here living on the islands, is that used as part of your data that you're assessing sort of positive cases which have either been here or potentially here in the island?
We don't use it in public health because we get all of that information separately from Public Health England, for example. So we don't currently access that data. But to say that you'll probably note, well, actually, no, you don't have any cases at the moment, on the island. So you won't have noticed. But if you're using the app, there's a space where you should be able to enter whether you've got a positive test result. It will not work for Scilly at the moment, and this is a major flaw with that app. So even if you got a positive test and you tried to go enter it in the app to tell all your, anyone who is around you through the app, it won't work at the moment. That's not to say stop using it. Keep using it because they're working on a workaround for it, which should be forthcoming. It's something we flagged to the testing cell. It's something we flagged to Public Health England and NHS England, but we've not got a fix for it yet. But keep using it because we need to get in the habit so when it does work really well that it will be able to let you all know immediately if you need to self-isolate. And I can say from first-hand experience on the mainland, it does work. People are getting messages saying you need to self-isolate because of a positive test. So once that flaw is unpicked in that app for Silly, it will work quite well and quite quickly, actually, and will really help us because actually it takes quite a lot of person power to contact cases, get in touch with their contacts and support everyone to isolate. So that will be really big help to us once that function is unlocked. Really good question, Dale.
Thank you. The reason I ask is, and I stand to be corrected, is the two main transport hubs to the island, which is, Land's End Airport and certainly here on the Quay, there is no offer of a QR code from the steamship company, or I find one when I flew through Land's End the other day, and I haven't seen one here on the Quay. And there's an awful lot of people, and as Tanya says, the Selonian 3 is going to be stopping soon, so there'll be even more people, or the only route, either through Land's End coming. So there's no option for people to check in.
Okay. Is there not in the airport? Is there? Well, we can unpick it. We've got our transport colleagues who meet with us regularly anyway, Dale. So let me unpick that with them and see what's possible and what they've already got in place.
Yeah. Well, as I said the other day, I couldn't see it, so hopefully we've got plans to pick one up. And I didn't understand why they haven't got one up yet when everyone else has.
I'll take that up, Dale, with Stuart straight after this call, because there's certainly one at St Mary's, and I don't see why there's not one at Land's End, but I'll pick that up.
Thanks, Paul.
Councillor Legg?
Yeah, just to come back in on that, I just, it was a couple of days after the app went live, I had to travel to the mainland and back, and at St Mary's Airport, saw the QR code and scanned in and was amazed at how quick and easy it was. For the rest of my journey, I completely forgot about it and I never noticed the signage. So unless you are consciously making an effort to, it's really hard. It certainly wasn't in my face, and that was travelling through train stations and Land's End Airport and supermarkets. I didn't. The signage wasn't in my face enough. You have to pay attention and think about it and make an effort.
I think you're exactly right. I think it's a bit like when we were all getting used to wearing face coverings everywhere. We've got to get used to thinking every time I go out, I need to look for that QR code and scan it. And it's not always in the most obvious place, I can tell you. It's also not required. It's not mandatory to do it. And so I think many businesses, and I know some over here, are trying to balance the in-your-face bit of it with not trying to force people to do it and putting customers off. But it is genuinely getting into that habit, I think, because for the most part, although taking Dale's point, the QR codes are there, but we've just got to, unfortunately, hunt sometimes for them.
Thank you. Any other question on the first part of witness update? I can't see any hands. So might we ask you to continue?
It's only just last little bits that I wanted to touch on. One was to support Paul's point that cases on the mainland, so in Cornwall, are roughly static, but actually starting to dip a bit. And there has been an incredible amount of work for the local incident response teams on the mainland, and we draw from those quite frequently as well in terms of how we support the school, how we support workplaces, our healthcare system. So they are just about the best you can get anywhere in the country, just so that you're aware, and it's going really, really well. These alerts are working very, very well. And what could have been very, very big, quite scary outbreaks were well contained and brought right down. So that's really positive news. The other thing locally that we're doing in terms of our alert is continuing to exercise our plans. So it's not that we did them, we put them on a shelf and we'll grab them whenever. We're continuing to exercise. So after the half term, we're going to have another exercise to make sure that we brush them off, we're good at this, we refresh our memories, make sure that we're ready to respond when it's necessary. The other bits and bobs, I know there will be a comms update, but just again to reiterate some of those things that we all need to think about, and that's one of the things I would ask of you as the Outbreak Engagement Board is everywhere you go, keep pushing those public health prevention messages. If people are going away for half term, just remember, if you become symptomatic and you've got to isolate, think about how you're going to do that on the mainland, for example. You've got students who've been away at uni, possibly wanting to come back for half term. Let's remind our friends and family that, hey, if you're coming back, make sure you've got no symptoms. And if you do, stay where you are, isolate and get a test. So it's just that stuff that we've, as we move into the winter, as we move into those periods where actually normally you'd go home and hang out with your family, you've just got to think through a few extra steps before those things happen. So I think it's really important that we consistently reinforce that with our friends and family and the public when we're out and about. I would really appreciate it because I think what we can look forward to in the winter is more snotty noses and flu and all other things possibly swirling around COVID. So, these things don't only help with COVID, they help with those other things that circulate as well. So it's really helping our friends, colleagues and neighbours keep well. And that's it. I'll stop sort of spewing at you, but is there any questions?
Thanks, Robin. I wonder if I could ask Tanya just to confirm that we are working on the two areas that you've mainly talked about. I know that Paul is working with Aisling Khan and the rest of the team on students returning to Scilly and people going away for half term. We've put a small amount of information on the council website, and whether or not Tanya at some point might think it appropriate that we expand on that, or whether or not you think it's sufficient. But we have alerted people to the fact that if they're symptomatic on the mainland, they will have to consider how they might manage that, and that they really should think about that before they think about going away. So would you like to contribute anything else, Tanya?
I think only to confirm what Whitney's already said, and if any more comms need to go out, then that will be done with Whitney in consultation with Tom Walton as the comms lead for the council. So I mean, we're happy with the comms that have gone out, and happy that we're reinforcing those messages across the community, just to make sure that if anyone is travelling either to or from the islands over half term, that they have those plans in place and they are thinking ahead in terms of what they need to do if they do become symptomatic when they are away on the mainland, or if they are symptomatic and they want to come home. So yes, just to confirm what Whitney's already said, and if we do need to do any more comms, then that will be agreed with Whitney and Tom.
Thank you. That's very reassuring. Dr. Curry, are you happy that we now move on to a general communications update from Tom Walton?
Yes, thank you, Chair.
So, Tom, can we have your communications monthly update now, please?
Yeah, thank you, Chairman. So Whitney's covered the main point I think the community have been concerned about over the past few weeks, which was about case numbers on the islands. There's been a big change in the way we report cases. It's now possible to point the community to the government website, which collates statistics by area, and it does specify, we've checked this, the Isles of Scilly is a separate area to the other regions in the south of Cornwall. The key on the map, as indicated earlier, is a bit confusing. We're noticing things changing on that map on a daily basis. We're keeping track of them, and Whitney's just clarified, that wording they've used is a bit scary, but it actually means our cases are extremely low at the moment. We are continuing to get the odd case, as mentioned earlier as well, where the postcode of the person is listed as the Isles of Scilly, but actually they're based on the mainland, so it's no increase in the number of cases on islands. So we're keeping track of all those things, and there haven't been any surprises recently other than the user interface changes for the map on the government website. We've been sharing lots of information about tiers, and I know there's a lot of questions in the community about travelling between them. The really clear information is about the very high tier areas. The government's very clear on you not being able to sort of easily move in and out of very high tier areas. It's less clear for for the middle tier, and I think that's where we're getting most questions. But as things stand, there just aren't currently the restrictions in place for that middle tier, what's called the high tier, as there are for the very high tier. We'll keep an eye on that. If that guidance changes, we'll let people know. But currently, it's the very high tier that people need to note for major restrictions on travelling from one area to another. As Councillor Williams noted, there's been some comms gone to the school. It's gone through their sort of direct channels, emails, etc., because obviously the 16 to 17-year-olds based on the mainland could be placed in a position where they need to isolate on the mainland, and obviously that's got implications for them. So they're getting supported and given guidance directly from the school and also council colleagues as well. And again, just to reiterate that point about anyone in half term or any time wanting to travel to the mainland, just please make sure there's some provision in place should you need to self-isolate on the mainland, because you won't be able to use public transport. And obviously there is that issue getting to Scilly. You're going to have to use public transport at some point in time. So just bear in mind you've got provision for that. What we would say, though, and what we have mentioned in our comms on the website, if you do find yourself in a difficult position, you can get in touch with Keep Scilly Safe at scilly.gov.uk, that email address. Do get in touch with us, and we can sort of give you advice and try and find a solution if you are faced with a very difficult problem. Test and trace support payments, they've been put in place now, and that's for people who are on very low incomes but need to self-isolate, so who can't work. That's in place. We've got information on the council website. There's access to £500 per week if you're put in that position, and that's to make sure that people are not put in a position where they're choosing between putting food on the table and self-isolating, so that it helps the whole community to stay safe. So anyone is encouraged to look at that if they're in that position. And there's also been an expansion of the job support scheme for firms that are required to close. It might not necessarily be an issue for firms on Scilly at the moment, but there's a wider issue that we're required to communicate that to the government. Whitney did a great job of explaining the issues surrounding the COVID app. So we're in a slightly tricky position. We obviously want to promote this as a tool for people to use, and there's a wider effect for the whole nation if everyone uses the app. So we absolutely do encourage everyone to use the app. When you're on the mainland, it should work like it does everywhere else. I know that the team are looking at ironing out that issue where we can get our data more easily into the app. But do download and use that app if you can. The LRF warning and informing meetings are back up and running again. They take place weekly, and that features comms leads from organisations across the southwest. That's councils, hospitals, universities. We have a weekly meeting where we discuss upcoming comms issues that affect people in the southwest. So that's everything from bonfire nights to Remembrance Sunday, etc., to actual outbreaks as well. It's interesting to hear everyone's feedback on events they've had to react to. It's been a very difficult time for communication in terms of, because the landscape changes constantly. So what you would communicate 2 months ago would look completely different now, because, for example, tiers didn't exist 2 months ago, and everyone's having to deal with those issues in a slightly different way. And been some great examples of communications in Cornwall during the recent outbreaks in the meatpacking plant, etc., where there were some really surprising outcomes from that. A lot of people were, for example, asymptomatic but tested positive for COVID, and a lot of really important information has been revealed from that, and it's some good information sharing across the region. We'll be doing a big tidy up of the council website COVID pages that we've got. So they were all set up right at the start of the pandemic, like everyone did, in reaction to what had happened. And we're definitely in for the long haul now. I think everyone's agreed on that. And we need to start changing the way we communicate in our sort of more long-term communications approach. So we're going to have to start hosting more of our COVID communication on actual service web pages instead of all collated into one location, because we're looking at, at the minute, we're looking at months and months more of this. We're also going to have to look at ways that the community can get in touch with us, because home working's had a big impact on the way people get in touch with the council and probably other businesses as well. So we need to look at how you phone someone at the council, how you email someone, how quickly you can get back. That's the kind of thing we're starting to look at. We can start planning for the future sort of 6 months. We are currently testing email subscriptions, so I know Councillor Legg will be pleased to hear this. He's very keen that we get email subscriptions up and running, as are we, and it will improve all of the council's communications. But for those people who want to hear what we have to say on COVID, but don't necessarily use social media, you'll be able to sort of subscribe to our email list, get all of our latest updates, and for anyone who's, maybe doesn't want to visit the website, you can get that full set of information from us. So that should be up and running after half term, we're looking at. So it's not a massive job, but it should be in place, and I think it'll be useful to quite a big group of people who don't necessarily enjoy social media. And the chairman's statement is continuing. We're doing it roughly weekly at the minute. We miss the odd week here and there, depending on if the chairman's around, etc. But the feedback we're getting is that people like it. They like it as a digest of information that's gone out recently. So we'll continue with that. And we're also aware that the community do like paper. So we will be printing some copies of this chairman's statement, as it gives that sort of broad overview of what's been going on. We'll be placing them in the library and in the paper shop. So that's it for now. I don't want to go into too much detail, because actually I was scooped by everybody during the meeting earlier. So.
Thank you, Tom. Some of the comeback I've had from accommodation providers have been around the tier advice with regard to journeys within the high tier. It's very clear from the very high tier that you should avoid staying overnight in another part of the UK. That's clear, and we have actually clarified that on the council website. What is not so clear, and I'm sure Dr. Curry would agree, is that the statement within the high tier, look to reduce the number of journeys where possible, is somewhat was somewhat flaky, really. It doesn't really clarify exactly what is meant. To some people, after difficult circumstances, a holiday would be considered essential. For other people, hopefully, perhaps, possibly not. So has anyone any more questions for Tom, or would Dr. Curry like to comment on that last comment of mine?
Sure. I think you're exactly right, Chair. It is one of those quintessentially wishy-washy government statements. This is public, isn't it? It's a difficult one, and I'll be honest, I've got a holiday let here, and I've got to make those decisions as well about whether I want people coming from a high-risk area coming to my holiday let and staying and letting people into my, where I live who are from those areas. There isn't anything saying that you can't do it. It does say limit those journeys. But if we think about the other bits of the guidance in terms of the rule of six, etc., if you try to apply those as well, in addition to the, not traveling as often, I think many of the questions might be answered, not all of them, but many of them you can start ruling out some of those people who are wanting to come via those other guidance statements as well. But I agree, it's not very clear. I know on the mainland, for instance, our colleagues that visit Cornwall and others are trying to seek further clarification on that. So it's being raised nationally as well. So it's not just an issue for us. But I know that doesn't fix the issue at the moment, but it is right now a judgment call that we're all having to make.
Thank you. Indeed, that is so. Questions for Tom after his communication update, please? I can't see any hands raised. Paul, can you, or Stephen?
No, I can't see any hands, Chair.
Dale has a legacy hand up, I suspect.
Dale, is your hand a legacy hand?
No, I didn't take my hand down. It's not up.
It is now.
I didn't do it.
Right, pausing for a minute. Then let's move on to the last item on this morning's agenda, which is, are there any other issues to be brought to the attention of the board? Would anyone like to raise anything that hasn't been covered?
One sort of last point from me, Chair. Paul mentioned Halloween coming up. I heard a suggestion that much like the rainbow walk that was created in the spring, the suggestion of people drawing pumpkins and Halloween-related things in windows for children to enjoy a Halloween walk, as trick-or-treating is obviously out this year. I thought that was a good suggestion to get people out and about doing some exercise.
Yes, that sounds good. It started already, actually. There's a wonderful window just down the road from my house. So hopefully we might be able to do something like that. Right, then it just remains for me to thank everyone for their time and contributions this morning, and to hope that we have a safe time until we have the next meeting. Thank you.
Chairman. Thanks, Chairman.